right, happy Friday, everyone. This is MetaFairs Talk. Today we have a very good topic, and it's something I'm very passionate about, which is kind of digital innovation within medical affairs. However, we are actually going to have slightly different angle where we're going to address this from a slightly different perspective, which is what are the new skills and capabilities that we need as medical affairs professionals in this evolving world, which is very much driven by new technologies and in particular, obviously, the digital transformation. So the specific, we're probably going to try to be broader, but we're going to be trying to specifically focus on field medical, because we have a subject matter expert in the field medical space, and obviously in the digital innovation of medical affairs. I'll let him introduce himself in a second. But I'm very, very excited. I think this is going to be a great discussion. I'm Luca Dezzani, Medical Affairs with Johnson & Johnson. Marieke.
Thank you, Luca. And I want to mention this, of course. I want to congratulate you and thank you for talking to Congress about men's health and prostate cancer, because I'm sure it was a wonderful experience, but this is so important. And this is essentially what we do. We are the patient's voice in a way, and we are there to enhance patient outcomes. That's what we always strive for and what we want to get better at over time, of course. So with this digital disruption, which is here, and disruptions are great because this is really where we have growth, and we're going to see lots of growth in many different areas. And for us to continue to excel, we're going to have to upskill. So I'm very happy that we have a wonderful guest here today. But before I hand it over to you, Randy, I want to make sure, don't forget about the comments. Wherever you are on social media, please let us know. We can read them, and we'll try to respond as we see them. So my name is Marieke Jonkman from the Medical Affairs Leadership Institute, and I want to welcome Randy to our show today.
Thank you very, very much. And what a pleasure to be with you all here on this call. And for those of you joining, first of all, I just want to thank you for making time for this at the end of the day on a Friday. I'm excited to be with you and share some perspectives around some ideas that I'm sure some of you are thinking about as you think about your day job and at your companies that you work at. I'll start with a little watermark, which is that these are my opinions, not that of my employer. But with that said, right, I've been in the medical affairs business for 23 years. I spent a chunk of my career at Boehringer Ingelheim for about 16 years, leading MSL teams in ops and governance as well. So I spent about 9 years in the compliance organization. So I understand and really care about how we think about governing and standards behind how we stand up field medical teams. Had an opportunity to go to another company up in Cambridge called Alnylam Pharmaceuticals, a rare disease company. Got to really understand, rare disease, which I hadn't had experience in at the time. Got to launch a product as a medical director for an ultra orphan disease, and I got to learn what best in class medical affairs really looks like. And then had the opportunity just over 2 years ago to come to Syneos Health, where we have global MSL teams around the world and clinical educators teams, and that's the group that I am responsible for. Pharmacist, PharmD by training, and an educator. So I worked when I was younger at Mass College of Pharmacy. That's where I developed a real love for teaching programs and that's what really this conversation really is about, as well as how do we think about in medical affairs, how do we learn and what do we need to be thinking about learning about so that we're at the forefront in our companies and helping shape strategy, which really never better than right now. Medical affairs is like that critical juncture between R&D and commercial, and more companies are doubling down on medical affairs expertise and seeing the true value of what med affairs brings to bear. And with that comes responsibility for us who work in medical affairs to upskill and think differently about what we do as we show up to work every day. So with that as a bit of a backdrop, I'm really thrilled to open this conversation up with you, Luca, and with you, Marieke.
Awesome. So maybe as we start to dissect a little bit the topic for today, one initial thought that comes to mind is Obviously, we are seeing quite a bit of, how can I say, disruptive innovation, things like generative AI and the metaverse, things that, quite frankly, we were not using at all, even just a few years ago, and now they are becoming more and more integrated in what we do in medical affairs. But I'd like to start, though, with maybe some of the foundational skills that we have been working on in medical affairs, and in particular field medical affairs, for quite some time, that still, for a reason or another, just because of this wave of innovation that medical affairs has been going through, we have to adjust, right? So we have brand new, completely different skills that we're going to have to learn, and maybe we can cover that in a minute. But why don't we start with some of the more traditional foundational skills that every MSL should have, but still we may take them to the next level in the next few years. What are your thoughts, Randy?
Yeah. So, I think at the foundation, at the root of what medical affairs does is we communicate science. So it starts with scientific rigor and acumen and the ability to interpret and understand complex science and be able to communicate that and to be a relevant source of like truth, right? And objective medical information. I don't think that's changed. And that's the roots of the foundation of what makes medical affairs unique. I think relationships become a foundation, right? How you build trust with an HCP or healthcare professional or another stakeholder to earn the right to another conversation. I mean, so relationship building is a thing that's been around. It remains a thing that will forever be important, that no digital tools, I don't think, replace human contact and trust. And so while what I would say is that each of those things I just mentioned, scientific communications, is evolving, right? And thinking about new ways and new skills on what it looks like to have an effective scientific engagement that's grounded in, a new kind of data, let's say, or a different kind of evidence. That's what's changing, is that the traditional randomized controlled trial that we used to always present, or a poster from a Congress that we would always present, now all of a sudden you're talking about different kinds of evidence, right? Cost effectiveness analyses. You're talking about registry data. You're talking about natural history studies. That's what's different, is that there's a new skill of today's medical affairs professional to understand how that data is generated and how to explain it to doctors and providers that might not actually understand how that evidence was generated. I would say on the relationship front, at the foundation, it's about being humane and solving problems and answering questions to providers and being a medical resource to them. What I think is changing, though, is what's our definition of who our stakeholders. So it's no longer just the doctor, right? It may be the physician assistant, the nurse practitioner. It could be a patient group. I heard a quote this week that patients are the new KOL. I think that's completely legitimate, right? You've got really well-read, highly intelligent, very informed patients that are providing really important input on patient-reported outcomes to define what goes into a study and how that data is getting consumed by ultimate consumers. Now, it's not just the doctor that matters. These patient groups are having a very substantive voice on decision-making and even guidelines. So the voice of patients become a really key part on how companies need to be thinking about the evidence that they curate and create. So I'd say I hope I answered your question, which is really like, what's been in the past, what has always been the foundations of field medical personnel and medical affairs personnel, that doesn't change, but there's an upskilling and a new expectation on what those areas look like. The other thing that I'll just say, I think that traditionally, medical affairs professionals were in the business of evidence generation and evidence dissemination, especially the field medical. We did a lot of explaining and showing data. Now, I think the next generation of medical affairs is about bringing in opportunities for evidence to be generated, right? Whether that's a collaborative research agreement between your company and a site that has access to a unique population or a unique data set, but really thinking about and understanding strategically, like, what are the priorities, the medical unmet need, what kinds of needs do you know about that through engagements you bring in opportunities for evidence to be generated? And I think those are some of the core of both what was and what is and what will be.
I want to add something to that. I want to echo a lot of what you're saying. I think we have to differentiate where, the new technologies, our new digital technologies, they're going to be much faster at data generation and putting things together. We as humans are not going to, we're not never going to be a computer. And that's a good thing because they can help us. But I think what we really have to focus on is how we as humans are adding depth to relationships, or we are building relationships. We are understanding, the greater, connections to it. We have empathy, and building those relations is going to be very important. And so in addition to building relationships, creative thinking and putting all these correlations together, um, you know, generative AI, they can generate data. But how, putting the connections between things and seeing different types of patterns is going to remain, our way of thinking. And that's really where we can make a difference. But we have to hone those skills more and better. We have to get more depth in that. And I agree that, obviously leadership, coaching, mentoring, those are all going to be very important things. And that's where we as medical affairs can differentiate ourselves, not just by the using of our new digital tools, but how we as humans add, depth and, breadth to it.
Yeah, I'll just add two things. One is healthcare is nuanced, and a patient is a human that has unique features and comorbidities, and doctors and providers go through lots of schooling, pharmacists go through lots of schooling to understand, particular instances where healthcare decision making is very nuanced. And I would argue that a computer can do an awful lot of that work, but it just doesn't understand nuance. And then the other thing that I would say is that we're seeing more of as we think about the training programs we offer and that we see clients looking for is there's a new way of influencing healthcare professionals. There's a we've always thought that the essence of scientific exchange is medical debate, but being able to help a doctor understand what came through a computer, right? A generative AI generated this kind of summary, and then understanding how doctors consume that information. That's also going to be insightful to help again make sure that a computer isn't making a decision for doctors. I mean, we still need smart doctors and healthcare providers to make good decisions.
And can I ask a question?
Go ahead.
Because, very recently, like in this morning, I heard, I'm older than Google. So what do I know? So we're having all these new, digital tools. How is this going to change? What do we need? Apparently, I don't know because I'm too old for that. I think, most of us are at this point. But how, what do we need to change digitally in our skills? Luca, Randy?
Luca, would you like to
Go ahead, Randy. Go ahead.
So if I understand your question right, Marieke, it's what do we need to what new skills do medical affairs professionals of the future need to be able to have to be relevant in this new digitized world, right? I'd say understanding. I mean, what a simple answer. I'll start with simple, right? Everyone's thinking and talking about omni-channel, and in medical affairs, some companies are more progressive, others are a little bit slower to adapt and adopt that. But I think all of us are going to be seeing omni-channel as a thing that's affecting medical affairs. And to me, it's about understanding how providers consume the information that's in these different channels. So whether your company has like a medical hub in which doctors can come when they want to and ask a chatbot a question and get the answer they need, that they may not need an MSL, or they have the ability to connect into medical affairs and request an MSL, or if they want to access a specific piece of scientific data, companies are putting together these portals where the poster library is available to doctors to get the information when they need. I think we'll probably start to see, if you will, a persona of an HCP, meaning how they're consuming all of this different information. Some of it comes from us to them. Some of it comes from them to us, meaning how they consume what we put out there. I think that's going to be a digital savvy that medical affairs professionals need to start to get their heads around, right? It's something that isn't necessarily fully fleshed out, but probably is a macro tech trend for med affairs to kind of double down on. I think that's I mean, I think we could spend an hour on that topic alone, but that's an example of maybe how I'm starting to think and how we're thinking, and maybe might be an important set of skills is how do you dissect the way that providers are consuming information? How do you use, like, when a doctor's on a particular slide for a certain period of time, or is downloading an article and then another article that has a similar topic, how do you take those two pieces of data and decide, the next time I meet with that doctor, what might I ask them? What might I talk to them about? What piece of data might I show them next to kind of continue that, or to create a continuum of learning to happen over time? I think that's the digital skill of tomorrow.
So now, Randy, I think we covered quite a bit of the kind of spectrum of what an MSL does, right? So we obviously spoke about, data and dissemination and scientific exchange. We spoke about evidence generation, and I loved your point around MSLs becoming more and more instrumental when it comes to evidence generation. Now, one obviously big bucket when it comes to what MSLs do is also insight generation. So trying to understand, how the treatment landscape is evolving, trying to understand how our products are being utilized and what we can do to fill gaps. So I guess also insight generation has been changing. If you think of the entire kind of social listening chapter, that's probably the best example of something that even just 2-3 years ago we were not doing that much, but now obviously is one of the key ways MSLs do insight generation. So any thoughts on that in terms of how also insight generation is evolving thanks to new technologies?
Yeah, so obviously our core currency has been and remains to be how good are we at gathering insights that are, often called actionable. And what beauty is in the eyes of the beholder, I often believe. Like, what is actionable according, what you might think is actionable versus what I think might be different. So insights are obviously a hot topic. How we listen, how we debate to get an insight, how do we curate those insights and make some sense of unstructured data. There are tools and tech available that are certainly better than I found from trying to manage Excel trackers. It's really hard to make sense of unstructured data. You need tools that empower you. But to your question about social media listening, I mean, we've certainly seen the importance of digital opinion leaders rising, and that sometimes we found that a digital opinion leader who wouldn't show up on a typical KOL identification exercise has more influence on healthcare delivery than any publication or abstract or bibliometric measure that you could typically find. So, so we've certainly been seeing how MSLs use the tweets and the retweets of a doctor to engage a certain way into things about what you talk about, what you show, why you show it. Again, these are people who have a very substantive influence on the delivery of healthcare and the consumption of scientific information. So we've seen the importance of thoughtful engagements with a provider who is provocative on social media. There are tools. There are good tools out there that help actually do this for you. That many of your companies probably have access to. And I'll say this about insights, right? They are the value. And I think it's critically important that if your companies are or aren't curating and thinking about an environment where MSLs, medical affairs, med info come together and share those insights, and that's comprehensive of the digital opinion leaders, the KOLs, and the non-KOLs. So, like, even if your teams are allowed or engaging patient groups as a stakeholder, because I think that's starting to become a thing as well, governed in a certain careful way. I think sharing of those insights, landing on decisions that as a medical affairs group, and even with partners from commercial or partners from R&D, what are we taking action on? What are we doing next? What are we not going to do? What are we not going to do can be very insightful. Not just what are we going to do, or how do we neutralize that opinion, or how do we do tactically, what do we want to take on? I think, in my past life, I've seen where a clinical trial did not get run through MSL insights, chosen not to, and that was a really good outcome, because ultimately the company didn't waste its money and effort, right, on a study that wasn't designed to answer the right questions. So those are powerful ways that insights generate value. And we talk a lot about value in medical affairs. It's through those insights that when you do it really well, and actions come as a result of field engagements, field interactions, field insights, it's pretty obvious when value is being realized.
No, go ahead.
Yeah, no, I just want to maybe very quickly address, I think, a very interesting question from Alex on the kind of compliance and regulatory framework, right? Because some of the new technologies, platforms that, including, what we were discussing earlier, the omni-channel, does have compliance and regulatory considerations and implications. And without going all the way to generative AI, I think we are really just scratching the surface there, and I don't think we have clarity on what's the kind of regulatory framework will look like there. But even just for omni-channel, do you have any best practices of words of wisdom in terms of what is the best approach when it comes to making sure that what we do from an omni-channel standpoint is fully compliant?
Yeah, I mean, it's a great question. So thanks, Alejandro, for asking. And I think this topic could be an hour-long session too. And omnichannel is a whole new world for all of us in medical affairs and with our compliance partners. I think everyone's trying to get their arms around what are these standards and procedures. Every company has its own sort of tolerance for proactive omni-channel, right? So banner advertisements, NPI tracking. These are things that we're seeing clients actually enable. Again, it's usually disease awareness message, not product message, to keep it in safe harbor. But what I would say is you've got to think about, as you're starting to think as from a medical communication standpoint, or even from a MedInfo standpoint, partnering with your compliance business partner is essential to understand the risk areas, to get ahead of the compliance concerns, so you don't waste your time on a campaign that ultimately gets pulled back for reasons that it's deemed to be somehow medical promotion. And we all are concerned about that. Is at the same time, we don't have to sit back and just be reactive. I think there are very governed ways in which medical affairs teams can be proactive, but it does take appropriate review and approval in partnership with your regulatory, your legal, your compliance team member, and explaining what you're doing and why, and what are the medical unmet needs that having a banner ad about a disease awareness or a screening testing campaign. There are ways to get this done. You just, on a case-by-case basis, you really do need a trusted partnership with your compliance business partner. And my only advice would be is never go after it's fully baked and ask for approval, meaning invite them to the conversation as you're getting even into concepts before you spend time and effort building anything. Partner with your regulatory, your compliance partners, lawyer, and ask, if not this, what then what, right? If don't accept no unless no makes sense. Ask for an explanation and ask for a different alternative. And there's usually another alternative that will still meet your business objectives.
Awesome. I think we have time for maybe one final question, and I'm going to ask maybe the same question to each of you. I'll start with you, Randy, again. What's your prediction when you think of medical affairs in 5 or 10 years from now? How do you see it being different? And what's your if you had to predict what medical affairs will look like, what do you think?
Yeah, so I'll touch on that. Before I give you my answer, I'll just say a couple things, right? I think clearly omni-channels here. We started to talk about it. Clearly digital opinion leaders and social listening is here. We talked about it. Clearly we talked about new kinds of data that are the new evidentiary standards, that medical affairs professionals are the ones creating the data and disseminating the data. When you think about all of that, new stakeholders, new kinds of data, and tools and tech that are going to make people smarter, right? To make them work more strategically and more thoughtfully. So they're going after so their engagements are more meaningful, right? With people who matter, on content that matters, so that we can affect healthcare delivery in a meaningful way. I don't think it's crazy for us to imagine a world with generative AI and tools like we've sort of started to talk about today. That and I'll use an example, which is sort of like in the field medical space, right? When we have a team of people out in the field, and oftentimes, medical affairs teams they cover a lot of area. I think it's actually very realistic. One day we might see a world where, just like you would talk to your Alexa or Siri or to some kind of somebody that's listening, and you could say, Alexa, I'm about to go make an appointment in Albany, New York. I'm seeing a gastroenterologist named Dr. Luca. Who else should I see when I'm in Albany, New York? And by the way, what should I talk about? Imagine a system that would tell you that in the Albany area, there are these 3 other doctors who may have recently ordered a diagnostic test for this disease that's rare. And the system is telling you that when you're in the Albany area, you may want to reach out to Dr. A, B, and C in addition to Dr. Luca. And you get much more efficiency if you're going to make a trip and travel. And I think systems are out there that are helping people, for example, things like next best action tools that are helping an MSL know, if I'm going to Albany, based on this doctor's persona, their prescribing likelihood, their patient population, maybe you want to talk to this doctor about these topics and about with this scientific data. And I do think that's going to make for more interesting and more robust engagements when people are traveling. And I don't think it's years away. I think it's in the near term that tech is going to actually make for smarter engagement. That would be my sense.
Marieke, your thoughts?
Well, first I want to apologize because when you said Alexa, mine started.
So did mine. So did mine. She was listening to me out there. Oh my office door.
A little worried there for a second. So I agree. I think within the next years we're going to be much more efficient about many different things. But I just read the report from MAPS about metrics in 2023, and we are not measuring what we're doing, and we're especially not measuring according to this report and using it to show our value to our other internal external stakeholders. So until we actually implement that, we can be so much quicker about it. How are we going to allocate the right resources to the right time? So I think we need to think about that in a little bit more closely. How about you, Luca?
Yeah, no. Well, I think I need to say I'm just gonna speak super quickly about generative AI because I was a big skeptical even just like 4 months ago, and now the more I'm using it, the more I'm exploring, the more pilots I do, the more I think has a fantastic potential. And by the way, I think generative AI has, in my view, terrific use cases that are probably not so far in the future. I think some of the things I've been exploring are things that we can pretty much do today. So again, if I have to make a prediction, is that definitely medical affairs will be transformed by generative AI, but not in a sense that people usually think of like, oh, we're going to replace MedInfo with generative AI. That's not what I anticipate. I think my prediction is that generative AI will become more and more integrated in everything we do. And you are not even going to think about generative AI because it's going to be fully embedded. I think the best example is when you think of Google Maps. Whenever when you are in your city, it will give you the 3-4 destinations where you go more often. You move to another place, it will give you other recommendations that very often are spot on, and that's actually where you want to go, and it will be one of the first results in your search. So that's like AI that is fully integrated, and you are not even seeing it. It's just happening in the back end. So we are at time. I want to answer Laura's questions real quick because I think it's a great one. I would go one step farther. I wouldn't just mention broadly digital skills because I think it's a little bit of a buzzword, but I think if you want to make it a bit more specific, in your application and really speak to, is it social listening? Is it big data? Is it, just be a bit more specific on what particular digital skills you think you are very strong with. And that's probably what I would encourage you to capture in your resume or your application. We are, as I said, we are at time. It's a Friday evening now. So thank you so much, Randy, for joining us as usual. And Marieke, thank you. We have our next MetaFairs talk on July 7th. And we are actually moving back to our 1 p.m. Eastern time. Today was, we had some other commitments. We had to push it later, but we are moving back to the 1 p.m., which is a much better time for anyone on the East Coast. So thank you again. Thank you, Randy, Marieke. Any final thoughts?
No, I'm glad we still had people, show up and come with the comments and questions. So I want to thank for that. And I'm sorry if we weren't able to answer everything. And with that, enjoy your weekends, and thank you very much, Randy.
Thank you, everyone. Appreciate the time.
Bye.
Bye.
Bye-bye.